Okay, this is a book review. The name of the book is How Dentists Scorn Science by Robert Yoho, Y-O-H-O. He's a cosmetic surgeon, also was an emergency room doctor, had problems himself. He had 17 amalgams, had developed a worsening tremor. He was diagnosed with Parkinson's disease. He also had noticed that he had anxiety problems and impulsive behavior, and that his testosterone was low. And these are all things that mercury amalgams can do. Amalgam is the name for the dental filling. They're 50% mercury. They call them silver fillings, which is a euphemism because mercury is a major toxin. Okay. He had some funny lines in the book. He said, "Dentistry is McDonald's medicine." I just threw in this one line, based on science, not truth, with the S spelled with the $sign. Caveat emptor means buyer beware. And it reminds one of the Machiavelli quote. I learned this quote in med school. Med school is Matilda the pill, send a bill, and then dental school is drill 'em, fill 'em, and bill 'em. Okay, here's a quote by Machiavelli. Lies are defended by force. Truth can defend itself. And what that means is, the dental associations, they'll tell a dentist if they, speak bad about mercury, they can lose their job, lose their license. So they first of all don't teach them the truth about mercury, and then by the time they get out, they're under pressure never to speak about the problems associated with it. So the kind of guys who write the best books are these old retired guys. So Yoho's an old retired doctor who was never a dentist, but old retired doctor, and some of the dentists that he does quote are old retired guys. Okay, mentions a lot of drugs contain fluoride. I'll make a separate video about that. That's too big of a topic to cover right now. Most people get chumped by dentists, and he had those little text messages, abbreviations, DFL, DFR. They don't effing learn, or they don't effing listen, and they don't effing read. Most people, in my experience, the vast majority of people, about 95% at least, are functional illiterates. They don't read. Which is kind of scary. It means they're easily tricked into stuff. You go to the grocery store, you see 95% of the toothpaste at the grocery store contains fluoride, which means they're ignoramuses. That was known many years ago. Gosh, I knew all about that about over 30 years ago. All right. Let's see what else. He did say some things. I don't know for sure if it's a good idea or not. He talked about getting a sun lamp in winter. If anybody's interested in vitamin D, McDougall has lectures on it. Also, the guy over at MedCram, his name is Dr. Roger Seheult, S-E-H-E-U-L-T. MedCram is pretty good for that. It's mostly conventional medicine stuff. He did a fellowship in sleep medicine as well, so he knows a lot about sunlight. He has good videos on that. Okay, amalgam, possible side effects from the mercury. You can get anxiety, impulsive behavior, poor sleep, depression, suicidal ideation. Dentists, by the way, have the highest suicide rates out of all the professions. I think because they're exposed to so much mercury. I asked one, dentist if he'd ever removed a mercury amalgam. He said he's removed thousands of them. Headache, memory worsening, multiple sclerosis. There's a whole bunch of case reports, according to these dentists, of people who they claim they've seen a lot of patients get resolution of multiple sclerosis from removing a dental amalgam. So I don't think that's the main cause, but it certainly sounds like it is one of the causes. So why not give it a try? It's a chance to be cured, or at least stop the progression of the disease. He himself, like I said, had Parkinson's disease. Mercury can also cause fatigue because it's a major inhibitor of mitochondrial function. So some people are more vulnerable to that. That's interesting as a potential cause of chronic fatigue syndrome. Poor pregnancy outcomes, low testosterone. He had to go on testosterone replacement when he was in his 40s. Amalgams, like I said, are 50% mercury, but they can also contain silver. The modern ones since 1976 contain more and more copper, which the dentists like because it's a better material for them to work with, but copper accelerates the rate at which mercury vapor exits the amalgam. And other dentists claim that it has dramatically increased the rate of multiple sclerosis, since 1976. Interestingly, they said no one even knew what MS was. MS wasn't even described until around 1830, which is around the time that dental amalgam started becoming more common. And they even claim in the book that the incidence of multiple sclerosis correlates very closely with the incidence of amalgams being placed. So they're making the argument that they think amalgams are the main cause of MS. I don't. I think the main cause is the whole swank stuff with leaky gut, but I do think dental mercury amalgam seems like it really does cause it, because they had so many cases. In this book it's discussed. I've read a couple other books on dentistry where it's also discussed in those books. Other sources of mercury exposure include a coal-burning electric plant, crematorium because it melts the person's amalgams, thimerosal and contact lens solutions, etc. Oh, by the way, before you put in an amalgam or any type of dental material, you can do skin tests to help them make sure the person's not allergic to it. They usually don't even test, and that would seem like a wise thing to do. For getting it removed, you want to go to IAOMT. That's the International Academy of Oral Pathology, Oral and Medical Toxicology. So IAOMT.org, and then you could find a dentist in your area. There's a lot of things they need to do to remove a mercury amalgam. They have to have a high volume air filtration system, oxygen for the patient by nasal mask, and these things called dental dams to seal the mouth from mercury, oral aerosol vacuums for the mercury vapor that cut the chunks into big pieces that they can remove them, and you prevent the patient from swallowing them. He says one of the things he does, the author of this book, Yoho, he sweats a lot and he even goes to sauna because he wants to get the mercury out of his body through sweating. I made a previous video about that, how our sweat glands are like little kidneys and they do help excrete mercury and some other toxic heavy metals. He says about half of the United States dentists are still placing amalgams. And he also says they often do the wisdom teeth pulling procedure, which he considers mostly a scam. Okay, root canal possible side effects. Root canals are very common, and what happens is the tooth is always dead. You devascularize it, and you leave in dead material. And he says they're always infected. Doesn't matter what they do. They tried all the different chemicals and surgical tools, and they cannot get rid of the bacteria that can live in the dentin tubules, the side pathways off the root canals. And they sit there, and they often, if they're hypoxic, they become anaerobic. The bacteria can undergo something called pleomorphic change, and they can change from being aerobic to anaerobic. And it's a problem because they'll release bacterial toxins, and the bacterial toxins from anaerobic bacteria, author claims, are more toxic than aerobic bacteria toxins, and that they can do damage to mitochondria. The bacteria themselves can even spread to the brain, cause a brain abscess. That's super freaking real. I can tell you, I'm a neuroradiologist, one of the fields that I do. I almost never see a brain abscess. Okay, I see a brain abscess, about once every 3 years. I really don't hardly ever see them. I also don't see that many primary brain tumors. Everybody always talks about primary brain tumors. I don't see them. I see METs all the time, metastatic tumor. I don't see primary GBMs that often. Okay, getting back to root canal side effects. You can get endocarditis, infection of the heart. That's also pretty rare. I mean, yeah, sure, every doctor's seen endocarditis, while they've been working in the hospital, but it's not common. What is common all day long, every day, is nonstop hypertension, diabetes, coronary artery disease, cerebral vascular disease. I see that like almost every case all day long, every day. Okay, root canals can cause subfertility in men, sinusitis, multiple sclerosis, arthritis, rheumatoid arthritis. But here's what I thought was most interesting. The idea that these anaerobic bacterial toxins can cause cancer because of what is like a Warburg effect, because they're mitochondrial inhibitors, some of them, and in so doing they injure the cell and it can switch to anaerobic metabolism through the metabolic theory of cancer. So that's pretty interesting. I made a separate video about that earlier today. I think it was called something like, What is a Carcinogen? That was the name of the video. So again, yeah, they claim multiple sclerosis wasn't even known until amalgam started becoming widespread about 1830, and that the global distribution of amalgams parallels that of multiple sclerosis. For a multiple sclerosis patient, they think all amalgams and root canals should be removed, and you got to make sure to debride the adjacent bone, like remove the periodontal ligament, in order to get the best results. The root canal procedure itself is to drill out the tooth, and then they try to sterilize it with toxic chemicals, and this never works. 100% failure. Okay, root canal, dead tooth always infected. Initially, a younger person who has a good immune system can keep it in check often, but it tends to get worse over time. And like I said, multiple dentists have seen MS resolve, arthritis, brain tumors, leukemia. People who were going to commit suicide tear up their note. Their mental health comes back when the root canals and the mercury are out. So that's interesting. Some of these famous IAOMT dentists like Hal Huggins and Robert Gamal say root canals should always, always, always be removed. And make sure that the adjacent bone is drilled clean, debrided of necrotic, infarcted, ischemic, infected bone. Yoho's wife had her root canals removed. He had them replaced with what are called ceramic posts, zirconia ceramic posts. They can be made ceramic posts with no metal. It's hard to figure out what's the best dental material for replacing after a root canal. For example, composite resins can contain metal, so they're not that good. A lot of things are alloys. They're not a single material. Like titanium posts for teeth, those are alloys, and those will contain aluminum and vanadium. I wouldn't want aluminum in your mouth. Okay. Yoho says ceramic implants with nitride coating are safer. One dentist said the best option was porcelain, cemented with an old-fashioned but safer zinc phosphate cement. That website, I think, relates to that subject. It's like Melissa, but with only one L.org. Metal toxins are a big problem for the human body because they're solid, so it's harder for the liver or the immune system to remove them. There's a guy by the name of Patrick Stortebecker, and he claims MS's primary lesion is not demyelination. He says it's an infection on the venous side. The little periventricular veins, Dawson's fingers perpendicular to the lateral ventricles, because the veins in the face are bidirectional. So what he believes is happening is the mercury from the amalgam is spreading retrograde through the bidirectional veins of the face and going to the brain, and that's causing MS-related lesions. He says you'll find sometimes the same bacterial bug in both of them. He says spinal cord lesions can be due to retrograde venous flow, like in Batson's plexus. Again, you're talking about bidirectional venous flow with no veins. And he thinks infections of the vagina or the gut can even potentially spread. And just to let you know, spinal cord involvement in MS, yes, it happens. Doesn't always happen, but it's still, I do see MS cases. If I'm covering neuro, I'll see, 1 or 2 a day. But it's rare in comparison with diabetes, hypertension, coronary artery disease, cerebral vascular disease. I see that again, every case, every day. Okay, what else did he say that was interesting? Oh, another thing too, when I was a kid, I was always told, don't pop your zit next to your nose because the infection could spread through the veins. They're bidirectional and go to your cavernous sinus in your brain, and that could thrombose, cavernous sinus thrombosis, and you could have a stroke. Cavernous sinus thrombosis is so rare. I see maybe one case every 10 years. Okay? That's a total zebra. That's almost a unicorn. That's a no copy. Okay, it's rare stuff. But that still was an interesting mechanism for potentially being the cause of MS. Okay, what are some websites he recommends? I just listed them all here for you. So if you want to take a look at these, you can check them out on your own. So, did I think it was a good book? Yeah, but it was a little bit crazy. I mean, he's all over the place. Maybe he's got mercury toxicity, I was thinking. The old joke is the dentists are mad hatters, like in Alice in Wonderland. The hatters were a little crazy because they were working with mercury chemical on the hats. But it did have some good information in there. He was trying to tell the truth to the best of his ability. He is a senior doctor, former, cosmetic plastic surgeon and ER doc, so he does have a lot of medical experience and knowledge. So anyways, I do think it was a good book. Not a great book, but it was a good book. So hope you found that helpful.